Good afternoon. I'm Lee Harris, Mayor of Shelby County, and pleased to be here on behalf of the Joint Task Force. First, a few announcements before we welcome to the podium the Director of our Health Department, Dr. Haushalter. First, we are preparing to bring to the Shelby County Commission on tomorrow a proposal for a second round of municipal relief for 6 cities in Shelby County: Arlington, Bartlett, Collierville, Millington, Lakeland, and Germantown. The second round of municipal relief plan calls for a $3.4 million transfer to those suburban cities to help support their COVID response efforts. This $3.4 million will be divided as you can see on the screen right now. This is our second municipal relief fund with the municipalities. It'll be, again, on the commission on Wednesday. It is being sponsored by former Chairman Mark Billingsley, who's really been a leader in structuring these programs so that we can make sure that each of our municipalities has access to resources so that they can mount a COVID response. This is, again, the second round of relief in terms of CARES dollars that the county has provided to the suburban municipalities. In the first round of municipal relief, which happened at the end of May, we provided about $6 million to the suburban municipalities. Just an additional reminder for background, in case you're wondering, only the city of Memphis and Shelby County were allowed to directly apply for COVID resources from the federal government. The suburban cities that I mentioned, those 6 cities were not able to apply for relief directly from the federal government. However, these municipalities are working aggressively to confront COVID and to slow the spread. And we all know that this virus has no boundaries, and that the only way we're going to mitigate risk is for all of us collectively to work together on our COVID response. The task force, speaking of making sure that we're all working on this, the task force continues to partner with our neighboring communities, particularly our more rural areas. The data has been moving around quite a bit, but we want to make sure we're collaborating as much as possible with those rural communities. In fact, according to one media report that caught a lot of attention that appeared in the Commercial Appeal recently, our neighbor to the northeast, Haywood County, has some of the highest numbers in the state, around 102 cases per 100,000 in population. That's why several days ago, the Shelby County Health Department sent a strike team to meet with officials from Haywood County and discuss several ways we can deepen our partnership with that rural community. We'll report out on the various ways that we will collaborate with Haywood County and try to slow the spread there. Suffice it to say again, this virus knows no boundaries, and the threat of spread in our nearby rural communities is a threat to Shelby County. Finally, a word on our beautiful comeback, which, as some of you already remember, is our program to support close contact businesses like barbershops and beauty shops. With the partnership of the Shelby County Commission and leadership from Commissioner Lowry, we've been able to set aside about $1 million in CARES funding to support these businesses. And from this $1 million, we're able to make grants of up to $2,000 to help these businesses recover and to make their environs safer for customers. These businesses will use their funding for COVID-related costs like cleaning and sanitizing, personal protective equipment, and disposable beauty supplies, to just give a few examples. Already we've had more than 200 businesses that have received notice of an award from this fund, and we still have resources left. And so on the screen you can see ways to apply if you're an owner of a close contact business like a barbershop, a beauty shop, or a nail salon. We have about $500,000 left. We've already noticed awards for 223 close contact businesses, and that represents $446,000 in awards. So about $500,000 of the $1 million fund is still out there, and we would encourage owners of close contact businesses to go to that website and to apply. The beauty shops and barber shops that have already received notice of awards are located all over Shelby County in 23 zip codes, and those businesses operate in Memphis, they operate in Germantown, in Bartlett, in Collierville, and in unincorporated Shelby County. We still have resources left, and the website, once again, is covid19.shelbycountytn.gov. Again, covid19.shelbycountytn.gov. We'll continue to support close contact businesses as they safely come back online. And we realize that we have a whole lot more to do to support the recovery and safe operation, and this is just a start. At this time, I'd like to welcome to the podium our Director of our Health Department, Dr. Elisa Haushalter. Thanks.
Thank you, Mayor Harris. Good afternoon, everyone. I'm going to provide just a snapshot today of our data. And what we want to spend our time on today is giving some updates on areas that we continue to have challenges. So after I give the snapshot, Dr. Randolph will give some additional insight into Health Directive number 11. And then I've asked David Sweat to join us to talk about some of our efforts over the weekend. We're really trying to do everything that we can as a health department, but also we know community members are trying to do everything they can to prevent the spike that we saw after the 4th of July. So we want to give an update specifically on Labor Day. As far as our current status, we have 28,478 cases, and that's 146 increased from yesterday. And at this time, we've experienced 397 deaths. Our reproductive rate still is below 1, which is positive news, and our positivity rate is hovering around that 11 to 11.5%. All of that means that we've been fairly stable now for a few weeks. I know that the community is anxious to hear when we're going to begin to reopen things, but as we've noted before, it's going to be really critical that we are attentive to see what the impact of not only schools opening and sports being played again, but also the impact of Labor Day. What we do know is that throughout the weekend, we continued to receive a significant number of complaints about businesses that were open despite the fact that by the health directive they should have been closed. So given that, we want to make sure that the community has sufficient information to make good choices about whether or not to open a business, but also whether or not to patronize a business. So I've asked Dr. Randolph to join us, and he's going to speak to Health Directive number 11. And then David's going to join us and talk specifically about the weekend, and then we'll open it up to questions, assuming that you have a lot of questions today. Thank you.
Thank you, Dr. Haushalter, Mayor Harris. Greetings, fellow citizens of Shelby County. I want to just spend a moment just sort of highlighting some of the key aspects of the health directive. As stated, we've had some complaints about some establishments who were open and operating when they should not have been. The health directive is very clear in stating that the following businesses are not open and should not be operating: bars, limited service restaurants, clubs, beer pubs, wine bars, multi-person bicycling vehicles that serve alcohol or beer. These establishments should not be open. We've had some reports where limited service restaurants were open, some thinking that they could operate. And I just want to remind everyone, when you are in doubt of what you should be doing, what's allowed, I encourage you to visit our website, shelbytnhealth.com, and click on the Health Directive link, and it would provide you with the guidance and the requirement that's expected of you. And so, limited service restaurants, you're not open. Full service restaurants, if you are selling more alcohol than food, you're not allowed to operate and be open. In order for full-service restaurants to operate, they must sell more than 50% food versus alcohol. Even if you are a full-service restaurant, there are safety measures that are required of not only you as a full-service restaurant, but all establishments, all businesses and services. For instance, people are still expected to wear their masks or face covering. I was told by one owner of an establishment that he thought that the face mask was required only when they walk into the establishment. No, while you're sitting at your table, conversing, waiting for your meal, you should have on your facial covering or your mask. Once your food comes to your table, you then take it off, eat. After you finish eating, put it back on, and after 2 hours, you should be up and out of the restaurant. That is what the health directive says. The 6 feet separation. We allow up to 6 people together at a table, but each person at that table must be 6 feet away from persons at the other table. And so the 6 feet distancing is very important. And there are other safety measures that's in place that's outlined in the health directive that applies to either the individual or all services and businesses, or to some specific businesses and services. So again, I urge you, if you have any questions, if you want to know what you want to do, check out the health directive. Use the health directive as your guidance for going about reopening and operating. I'm going to have Mr. Sweat to come and talk about the actual enforcement efforts that we've had as it pertains to the health directive. Mr. Sweat.
Good afternoon. So for the past couple of weekends, we've had a number of inspectors out in the community visiting establishments with the health directive in hand, and also to meet with management, meet with owners, make sure they understood before enforcement activities would ever take place what the requirements were for by the health directive for their establishment, and ensure that they had full understanding of those requirements. But then additionally, particularly last weekend and then the weekend that we just had, the 3-day weekend, we've had inspectors going out in the field and double checking to verify that businesses that had been interacted with in an engagement way were now in a compliance mode, and then taking actions if they failed to be in such a mode. And so over the 3-day weekend, we had 11 different establishments that we visited to assess their level of compliance with the provisions of the health directive. Found that 6 of those establishments were fully compliant with what applied for their facilities. But then we did identify 5 that were not in compliance. And we did close those 5 establishments. But over the course of the weekend, that meant we had multiple interactions with them, with the assistance also of the Memphis Police Department, to ensure that the closure notices that have been posted on those businesses were carried out, and that the businesses were in fact closed to patrons. So I guess the message that I would have is multiple. We also did go to some of the events over the weekend that everybody knows about. We visited Tiger Lane, and we're pleased to see full compliance with the no tailgating provisions at the Liberty Bowl, and also observed that social distancing was followed as directed in the Liberty Bowl for the game. And to the establishments that we visited with and engaged with that were in compliance and we're operating according to the provisions, we want to say thank you very much, because that shows your dedication to our community and your understanding and application of appropriate measures for your facility. And then to the facilities that did not choose to adhere to the provisions of the health directive as laid out, I guess the message is we are out there doing enforcement actions, and that we have a coordinated effort between the Sheriff's Department, the Memphis Police Department, the county government, and city governments across the county to enforce the health directive and intend to do so. So with that, I will open it up for questions for any of us.
Kendall Downing, WMC.
Hey everyone, I was wondering if you could give us, is there a list of those 5 establishments? It's going to be released publicly that we can, move from there, and then I have a follow-up.
We will, yes, we've been allowed to release the establishments, so we'll follow up through Chip Washington to get that list published.
Okay, perfect. The other thing, I know you kind of touched on this, overall, what did you all feel about Labor Day? It sounds like there were some good things and bad things. Tiger Lane and the game was a good thing, but maybe some other activities that were going on, not so great. How does the department feel in evaluating the weekend? Thank you.
Thank you, Kendall. So, yes, I think we would consider it a successful weekend, but a mixed weekend, right? So we would prefer not to be engaged in any enforcement activities with facilities that were out of compliance, but we were grateful for those that were in compliance, and we certainly were heartened to see responsible partnership around the reopening of the Liberty Bowl for games and at the University of Memphis. I guess I would ask Dr. Householder if she cares to comment on that. No. So I think we would say it was a mixed weekend, but there were plenty of positive elements to it.
Sam Hardiman, Commercial Appeal.
Hi, my first question is, and this is mostly for Dr. Sweat, has the modeling group at the task force considered what the fall and the decline in temperatures could do to the transmission rate of the virus? And then I have a follow-up.
Right. So one of the things that we've observed across the world with COVID-19 is that the virus is very little impacted by temperature or weather or climate. And so it's a virus that will continue to spread whenever it is able to find susceptible hosts, and therefore whether the weather is warm or whether the weather is cool doesn't seem to change anything about the virus's ability to infect people. Obviously, what does change the virus's opportunity to meet new hosts or human behaviors. And we do know that with colder weather, that people are inside in a more congregated way and interacting perhaps, or could be, and that would increase the risk of transmission, or could increase the risk of transmission. We see that with some other viruses and also mycobacteria such as tuberculosis. So we have not done specific modeling around that, but we have been observing some of the data coming out from the Southern Hemisphere where they are currently in their flu season. And one of the things that we are seeing in the Southern Hemisphere is that influenza season seems to be relatively mild at this point, and speculation is that the respiratory etiquette practices, social distancing practices, the wearing a mask, the emphasis on hand washing and hand hygiene, all those things interfere with transmission of influenza just as they do with transmission of COVID-19. And so we're hopeful that if everybody will adhere to these practices and then also get a flu shot as soon as possible once they're available to you, that all of those things could help you stay healthier throughout the fall.
My follow-up is mostly a procedural question. The past 2 weekends, the hospital resource tracking system data has not updated over the weekend and sort of giving, you know, a little bit of a blank space as to how hospital capacity fluctuated over time. What's going on with that?
It's mostly a reporting issue of data being slow to come in. So it's a conversation we'll have with the hospital and healthcare sectors this week to ensure that they remember to fully report, even on the weekends, their data.
Alex Coleman, WREG.
Yes, my question is for Mr. Sweat. Based on the current data, do we appear to be moving any closer to reopening even more businesses? What's the feeling like there?
Well, the numbers are improving at a rate that is still occurring, but it's not accelerating very rapidly. The declines continue to occur, but the positivity rates are staying stubbornly stuck at around 11%. So we will continue to evaluate that. One of the things that has been declared many times prior to this past weekend, the holiday weekend, is that no changes were going to be contemplated by the Joint Task Force until at least 2 weeks after this past weekend. So for the next week, 2 weeks, we're staying the course, but we'll continue to watch the data, and then decisions will be made at that time once we determine whether the school reopenings, the resumption of activities such as athletic events and larger gatherings, and the activities of the Labor Day weekend have given the epidemic any new energy. But it'll be a few days before we know whether that's true.
And my follow-up is for Mayor Lee Harris. And Mayor, I was wondering regarding the relief dollars for the municipalities and for the close contact businesses, how soon would some of those monies be going out to the community?
Thanks for that. I think the short of it is some of that money has already gone out. So that is a continuous process. We even released a preliminary set of names of some of the businesses that have received notice of awards or actual checks, and so I'd refer you to that list. We're happy to provide additional names if need be, if you want to follow up with some of those businesses and see how it's going. But it is just the start, and we're hopeful that we'll be able to do more to support safe recovery. With respect to your first question, we just talked about, you know, how quickly can we open up more businesses, eliminate the curfew on restaurants, and expand the number of spectators that can attend football games and so forth. And I just want to make sure that everyone gets part of the message is that we're focused right now on the schools and trying to keep those schools that are open, and trying to create a path for the safe return to school opening for Shelby County school students that are now in a virtual mode. That's one of the really, really top priorities, and it is very difficult, this process. But it's even more difficult to think about the number of spectators at some games when we don't have a good path forward for school children and making sure their education and welfare is taken good care of. And so we're going to have a lot more to say about supporting businesses. And as someone who's owned a small business, this is just a horrible year and a very difficult and tough process. But I will say one of the priorities right now is the education and welfare of kids. Thanks.
Jane Roberts, Daily Memphian.
Could you talk about the high positivity rate yesterday and what we might learn from that?
Thank you, Jane. I believe, I want to just ask a follow-up, or ask to make sure I understand what you mean. Are you referring to the numbers that were reported on the Live Stories data page for the health department yesterday?
Yes.
Right. So what we saw there, and for those of you who maybe had other things to do yesterday and weren't watching our data page, what she references is that we had 125 new cases reported from Sunday, but that there were only, it only showed an evidence of 160 new tests, and that was an error. There were actually, there was a glitch in the updating of that data point in the automatic data feed with live stories, so it looked like there were only 160 new tests. There were actually over 1,500 new tests, and so the positivity rate was not as high as it would have been if 125 out of 160 tests were positive.
Jane, did you have a follow-up? We may have lost Jane. We'll go to Brad Broders with Local 24.
Good afternoon, everyone. This question is for David and maybe Dr. Haushalter as well. You probably know today is the 6-month anniversary of our first confirmed case in Shelby County. Just kind of looking back these last 6 months, what would be your message to the public about what we've done right, what we haven't done right, and maybe what the next 6 months might be in store for us?
I'm going to let Dr. Haushalter take most of that, but I will note you're correct. It was 6 months ago today that the very first case was diagnosed and reported to us. From my perspective in the process, I think what as a community we've done very well is the collaboration between the different sectors, between the different political entities, between the different agencies in the response. I think what we've done with the Joint Task Force is, if it's not unique, it's certainly a best practice and an example to other communities on how to respond effectively to public health emergencies. But I'm going to turn over to the director for the rest.
Thank you, David. I'll just make a few comments in addition to what David said and then go back to collaboration. I would say from the very beginning, one of the things that we did well in Shelby County is we actually started planning for that first case before we ever had the first case. And we have very close working relationships with our healthcare systems, and so the first case was reported in a very timely manner. And from that point forward, collaboration really has been our strong suit. As I've said before, sometimes we have very heated discussion and robust debate, but it does allow us to have many perspectives at the table and to hear those different perspectives so that as a larger community, particularly countywide, we have the ability to make sound decisions in a timely manner. Where I think we have continued to be challenged is the same place that other communities have been challenged. This is very difficult for everyone. It's difficult emotionally, it's difficult economically, it's difficult socially. And so in some time periods, we really have been exhausted with COVID. We've wanted to open things sooner than we really should have opened them. Or at times, some individuals may have wanted to close down sooner than we needed to close down. But with that said, I think it's important that we continue to look forward. We continue to look at the economic impact. I really want to commend Mayor Harris. He's very sensitive and empathetic to the economic impact, particularly on small businesses, but has taken that empathy to action. So we really appreciate that and look forward to continuing to do things to support our community collectively and to support each other as we move forward. And then I wanted to end with, there are additional supports that are available, including a 24-hour emotional support line, and Dorcas Young-Griffin will be here with us this week on Thursday to be able to talk about some of the additional support. So I would say that's our other strength, is that we have taken the information that we have and tried to take action on that to be able to support our community and support each other as much as we can. I'm sure if you asked us that question a year from now, we may look back and have some different answers. And clearly we need to stay the course. That's been the message now for several weeks. And that's where we need to stay focused, is to stay the course and stay focused on those basic principles of facial covering, social distancing, really protecting our vulnerable populations and making sound decisions about not only travel but what events we attend. And then as a nurse, it's important that I reinforce hand washing.
Thanks. And as a quick follow-up, just to end the briefing, David, you said 5 were closed in a week. In the last couple of weekends, you've been out. First of all, how long would those 5 businesses be closed, and how would you characterize 5 in one weekend being closed? Is that a lot? How have the last 2 weekends been compared to previous times?
So I can go ahead and address that just for timeliness. Our approach all along has been education and engagement, trying to assist businesses to come into compliance on their own. And unfortunately, however, that has not always happened. So 5 in one weekend is more than we would have liked to close, but we have reached a point that we know that there are facilities that continue to have large crowds, that continue to sell alcohol, and continue to have individuals who are neither social distancing or face masking. And so while we would prefer not to close any business, unfortunately we have reached that place that we will have to close those businesses. They will remain closed. Really, they're supposed to be closed because of the health directive. But anyone that's been closed will remain closed until the health department or Dr. Randolph or I specifically say that they can reopen. There are additional penalties that can be assessed, that if a business decides to open after we've closed them, then they can be charged with a misdemeanor that has a fine accompanied with that.
We are out of time. Are there any closing messages?
I just want to remind everyone to stay the course. We do need to look 2 weeks out from now to see what the impact of the Labor Day weekend is on our numbers. Our hopes are that we won't have the impact that we had in July, and then remind people to go to Shelby TN Health for any information or questions that they may have. They can see the health directive, but they can also email us directly. Thank you.
Thanks, everyone.